A really common question when it comes to Medicare is, does Medicare cover dental, vision, or hearing? It's a little bit unique, right? Because you see all the ads talking about those benefits. But let's get clear on what Medicare A or B covers when it comes to the dental, the vision, and the hearing. And then how can Medicare Advantage or other standalone coverage plans help you cover these extra benefits? So I'm Emily with the Medicare Coach. We're an independent Medicare consultant helping our clients easily navigate both the Medicare rules from the government, but also the insurance company options. Our goal is to help you do what's right and best for you to have the best healthcare while also protecting your retirement savings. I have some extra resources down below to make your life easier when it comes to Medicare. So, does Medicare cover dental, vision, or hearing? The answer is yes and no. Medicare A or B, it's usually Medicare Part B, covers medically necessary vision, dental, or hearing services. So let's do the easier ones. Dental and hearing are a little bit more straightforward because Medicare doesn't cover most of it. So when you think about dental coverage, what is medically necessary? For example, if you have a tooth that's in your mouth and it's infected and it has to be pulled, that infected tooth has to be pulled, Medicare will pay for that tooth to be pulled. It will not, though, pay for that tooth or new tooth to be put in. So it's an extraction only because it's what they're calling medically necessary. But for all other dental services, Medicare does not cover a ton. I'll talk in a second about how you can get that covered though as well. Hearing is very similar. Medicare will cover ear-related services if it's medically necessary, which is usually around a balance or other, again, medically necessary issues. So Medicare will not cover, say, hearing aids. The thing with hearing aids is that some Advantage plans will provide some additional benefits. They look at the fine print to see what the rules are, how much they're going to cover, where you can get them from, all those things. Many of our clients prefer to simply self-pay for their hearing coverage, as insurance plans aren't usually all that great. And what we've been told by many people across the entire country is that Costco tends to have the best hearing aids for the lowest prices. Now, there are a few other companies coming out as well that have very good services with very low prices or very competitive prices. So it's always good to look out for the newest company coming out, but I know that Costco tends to be a really good source for hearing aids from what people have told us. So there's not usually an extra place to get hearing coverage unless you're going to go for a Medicare Advantage plan, which could provide some extra benefits with some caveats. I don't recommend, though, that you only go with Medicare Advantage simply because of hearing. If you've seen my other videos, there are other important factors to help you decide which program does fit you best. And because of Medicare's guarantee issuance rules, it can be hard to undo certain situations. So please be thoughtful about your long-term Medicare decision. Now, vision. Medicare covers medically necessary vision. Things like cataracts, glaucoma, macular degeneration, things like that. Really some of the most expensive things. Now, if you're a diabetic, you will also get additional vision services. But for most people, if you want to get care for, say, an eye or coverage for, say, an eye exam or glasses or contact lenses, any of those things, those are either going to be one, out of pocket, or two, covered by some other type of insurance. Yes, some Advantage plans will include extra benefits for, say, an eye exam a year and maybe $100 towards a lens or a glass, whatever it might be. There are other plans out there as well that could help provide you vision benefits in addition to that. Sometimes too, Medicare supplement companies will allow you to add on additional vision benefits for a slight increase in charge. My point is this: Medicare does cover, I think, a lot of the expensive vision benefits, but there are other ways to get coverage for vision benefits, even if you don't go on Medicare Advantage or don't get it through your Medicare supplement. My recommendation is that you talk to your eye doctor and understand what plan do they accept. Like VSP is a really big provider when it comes to eye insurance. I also want you to ask yourself, what is your goal for vision care? What do you want to have covered? And then look at both the plan premium as well as the plan detail and decide for yourself, are you better off paying for a health insurance plan, paying for a vision plan separately that might give you $100 toward a lens and a free eye exam? Or are you better off self-paying so you have more options for all your different coverage? With all the new companies coming out for discounted eyeglass lenses, it can be pretty affordable to even self-pay. So do your research, make a decision that makes sense for you, but it is not uncommon for people just to want to self-pay for their eye coverage. Now, when it comes to dental, as I mentioned, Medicare covers basically no dental. So there's a couple things that we see people do with dental. One, your Advantage plan might cover your dentist. But I don't, again, recommend you pick out Advantage simply for the dental coverage. What I recommend that you do is go to your dentist and ask your dentist and their office, what dental plans do you accept? And which plans tend to pay the most for the coverage? Now, as we're sitting here in early 2025, in most cases, dental benefits are costing around between, I'd say the high-end dental plans are costing between $50 and $100 a month for the coverage. So what, about $1,200 a year? They tend to have instant initial coverage for preventative services, so cleanings, things like that. But anything else, any other fillings, any other non-preventative care, you usually have a 6 to 12 month waiting period. And so for that reason, one, we want to ask your dentist what plans do they accept. Two, we want to ask, are you currently on a dental plan that you could possibly roll over to waive those waiting periods? Or three, are you better off just simply self-paying for your dental coverage? Some dentist office, as of now, I see it a lot more frequently recently, is that they're actually offering quite a bit of a discount if you'll just self-pay. So my point is this, similar to extra vision coverage, talk to your provider and understand what are your options, who pays the best coverage, and what makes the most sense given your situation. Again, some people are better off getting extra coverage. Some people aren't. It's all going to be about you. Our coaches help our clients think about those decisions, think about the impacts of things. But you can also take a look at it on your own if you prefer that. So again, talk to your providers, get clear. Medicare covers a lot when it comes to vision, but not much when it comes to dental or hearing. So I hope you found this helpful. Make sure you leave your questions below or like this video if you found it helpful as well. All right, here's to helping you easily make your right Medicare decision.